It feels like a real milestone in Singapore's approach to COVID-19. What the government is telling us, and in fact the co-chairs of the multi-ministry task force when it comes to controlling this disease, is that we need to live with it, that the Delta variant being so transmissible means we may not be able to get to a situation of zero cases. So how do we live with it? Well, boosting vaccinations will be key, and Singapore wants to see at least 2/3 of its population vaccinated by August. And what's interesting about that is it compares with other nations in this region, which show vaccination levels at a much lower level, in particular in other financial hubs such as Hong Kong, where the uptake of vaccination has been much slower. Here in Singapore, though, the focus will also be on testing. For example, test kits will be made more readily available in pharmacies, and Singapore is also developing a breathalyzer which will help detect COVID-19. Alongside this, it will all be about ring-fencing cases and making sure that we don't see further spread. So in the same way that you might stay off work if you have a case of the flu, you would do the same if you test positive for COVID-19. What all of this means, though, is that there is no end in sight yet to the restrictions that we've seen on our daily lives, such as wearing masks or social distancing. All of this will continue. Very much in Singapore's roadmap for the future and the new normal will be an acceptance, a sort of social acceptance that we need to take care of one another and that we need to take responsibility. Social responsibility is the term being used here. But this is all towards a new normal, and as yet the government hasn't specifically set out the guidelines, but we can expect to see them soon. Reporting from Singapore for CNN, I'm Manisha Tank.